Some people have healthy gums, which means that the gum and the bone are healthy, the bacteria is under control, and they're stable. So if these patients are stable, then they come in every 6 months, twice a year, to get their teeth cleaned and keep their gums healthy and at a baseline. Some folks have periodontal or gum disease, and that can happen for a number of reasons. Some of the main reasons are time away from a dental office. If it's been 10, 15 years, this bacteria can cause problems in that amount of time. And some people have a genetic predisposition to gum disease. We're all born with a clean slate, but then whoever raises us, whoever, your mother, your father, your aunt, your grandmother, inoculates you and gives you the type of bacteria that you take with through life. So if this bacteria is aggressive bacteria that causes gum disease, then you have a genetic predisposition that can lead to gum issues. Everyone has bacteria in their mouth that we call opportunistic, which means that it's good bacteria and it's bad bacteria at the same time. If it's maintained, it's okay. If it gets out of whack or there's too much of it, it causes problems or it takes over. So in the case of someone with gum disease, the bacteria is above the level of the gum. It's on the teeth and it's above the gum level. And it's what we call aerobic bacteria, meaning that it needs oxygen to survive. In cases where there's gum disease, this bacteria changes and it gets down below the gum line and down below the teeth onto the tooth structure and close to the bone that supports the teeth. That's a problem because the bacteria changes from being aerobic or oxygen bacteria to being anaerobic or not needing oxygen to cause a problem. And then it builds up on the gums and it slowly eats away at the bone. And so the bone can drop over time. So typically people that have gum disease, it means that not only are the gums a mess, maybe red or inflamed or hurting or unattractive, but also the underlying bone is shrinking, which makes the teeth unstable. At Sanchez Henry Dental Associates, we use different modalities to remove this anaerobic bad bacteria. We use hand instrumentation or traditional scaling and root planing, where we remove the bacteria from underneath the gum. We also use what's called an ultrasonic. It's a vibrating instrument that has water and removes bacteria. We also use a laser, which helps to remove the bad bacteria from underneath the gum, as well as antibiotics that help the body fight off the bad bacteria and get you healthy. Aside from the fact that a healthy gum leads to healthy bone, healthy roots, healthy teeth, healthy mouth, having healthy teeth and healthy gums also means having a healthy body. The same bacteria that's found in clogged arteries is the same bacteria that's found in gum disease. This is why it's important to come in and get your teeth cleaned and have your gums maintained to keep this bacteria, to keep the gums, to keep the underlying bone, and to keep the teeth healthy and keep everything maintained. And if you are prone to gum disease, then this is the only way to maintain it. And the key here after that procedure is maintenance. The best way to maintain the gums is proper home care, brushing teeth 2 times a day, flossing, picking, using a water pick, stimulating the tissues, and then also coming back to the dental office on an increased regimen, an increased schedule, meaning coming every 3 to 4 months for a cleaning to make sure we keep this bacteria stabilized and keep everything healthy. If we have any other issues that come up that need addressed, maybe we need an implant, maybe we need a crown, maybe we need some fillings, the foundation has to be healthy so other procedures that might need to be done will last. It's just like building a house. If the foundation is rocky and it's not even, then the house is not going to stay up. It's the same thing with the teeth and work that needs to be done. The gums and the teeth have to be healthy. They lead the way. They have to be stable so that the work that we can do will last. Periodontal health and maintenance is definitely a partnership. You have a dental hygienist and a dentist and a team that helps you get healthy, but it's largely up to you to stay healthy and to do your part at home. The only way that certain procedures are going to work, crowns, fillings, implants are going to work, is if the entire team is utilized. You as the patient, the hygienist, and the dentist. Periodontal disease is one of the top 3 leading chronic health conditions in the United States. It's up there with heart disease and diabetes. If you have gum disease, you have to work 3 times harder than someone who doesn't to keep fillings, crowns, implants clean. Just because the teeth are white and straight, pretty, and aesthetically pleasing doesn't mean that the entire ecosystem is healthy. Over half of our patients come to see us with some sort of gum or periodontal issue here at Sanchez Henry Dental. We're really good at this. We're really good at treating gum disease. Our highly trained registered dental hygienists have the background, the experience, and the knowledge to treat these gums and keep you healthy. We have a practice that has a lot of folks that come in that have gum disease or have had gum disease that we have been maintaining for years. If you have questions about your gum health or gum issues, give us a call.